Good afternoon, everyone. How about that panel? I'm still, the strength in our differences. I just really moved me, so thank you. Thank you for sharing that. My name's Stacia Edwards, and I'm the Deputy Provost here at City Colleges, and I have had the privilege in my career to work at the intersection of economic development, workforce development, and education for a lot of the time that I've been working. So what I'd like to do right now, as the panel comes up, is set the stage for the conversation with these esteemed panelists to make sure that you know a little bit about City Colleges. Now, I know most of you are like, yeah, we already know that, but I think it's really important for the conversation that we're going to have today to remember that we have 7 independently accredited colleges, and that each college is a comprehensive college, meaning students can complete a myriad of degree programs at each institution, including a whole AA, Associate of Arts or Associate of Science. Additionally, many transfer pathways exist in specific programs to our 4-year partners. And you can do that at all 7 of our colleges. But in our conversation today, we're going to be talking about preparing students for the workforce, and one of the ways we do this is through a framework that we call Centers of Excellence. The Centers of Excellence follow a sector approach for engaging partners and organizing programs that are important to businesses in Chicago's economy. And we have a rockin' awesome economy in the city of Chicago. In fact, Chicago has such a diverse economy that no industry represents more than 12% of our economy. Now, some people will say that that means that we're recession-proof, but what it means for most of us is that the programs that we build, when we know we have a lot of companies and the industry there, we're gonna be able to connect our students with that workforce. Additionally, so we design our programs to have immediate workforce relevance when it's possible, and each of our colleges have this Center of Excellence. So we have programs at Olive Harvey and transportation, distribution, and logistics. We have programs here at Malcolm X, and we have an esteemed panelist here in healthcare. You can go to our website and see all of the Centers of Excellence that we have. And the host college of a Center of Excellence is responsible for ensuring that the programming is relevant, building strong partnerships with the community and employers, building and sustaining high-quality programs, and ensuring access for both the students and for the businesses. But beyond quality programming and partnership development, you're going to hear more from our panel today about the importance of this strategy for delivering equitable outcomes for our students. The Center of Excellence are not a two-dimensional approach, school or work. Sometimes I say school, smiley face, work, frowny face. Instead, the strategy is intended to expose and connect students to opportunities where they can learn, earn, and continue their education if desired. Many of our students are first generation. Many of our students haven't been exposed to that beautiful economy I was just describing. And like some in this room, have no idea of the opportunities that exist in this economy. I mean, if you think about what was said earlier today about quantum, I think you might have said immune science, also molecular engineering. These are things that most people don't know about. So through a successful Center of Excellence strategy and deployment, we can connect more students with life and family-changing jobs and careers in this local economy. So what I'd like to do now is I'd like each panelist to briefly introduce themselves, and then we're going to get started. Roy, can you start for us?
Can you hear me? Okay. Good afternoon, everyone. Thank you guys for coming to Malcolm X College. My name is Roy Walker. I am the Interim Vice President of Academic and Student Affairs here. Prior to my tenure in this role, I served as the Executive Dean of Health Science and Career Programs here at Malcolm X. We have a little over 20 healthcare professional programs in which we manage in our portfolio, most of which required engagement with workforce partners, both in the clinical setting vis-a-vis the hospital and also some community-based organizations. So thank you for having me.
Thank you. David?
Yes, all right. Good
Please.
afternoon. And thank you so much for having me today. It's really an honor and a privilege. My name is David Jaeger. I'm with the Zurich Insurance in Zurich, North America, and I'm here today to share a little bit about the Zurich Apprenticeship Program, which offers a pathway for individuals looking to earn and learn at the same time through a 2-year program, which results in a full-time job and salary for apprentices.
Thank you. And Liz?
Hi, I'm Elizabeth Zachry Rutschow. I am a managing researcher at the American Institutes for Research, or AIR. I am also helping lead our Promise Center, which I'll be talking about a little bit today, which is really a comprehensive approach to adapt effective workforce training practices across diverse settings for diverse populations to improve the workforce equity for all individuals.
Okay, thank you, everyone. So Roy, I would like to start with you. Because you represent Malcolm X and our Healthcare Center of Excellence, would you share with us what that means from an operational perspective? And how is that beneficial to the regional employers when connecting to talent?
Sure. So given that we are the healthcare campus, we have probably the largest number of specialized accredited programs. What that means is that our accreditors require us to have ongoing engagement with our workforce partners. And their participation in our programs are really 2, if not 3-fold. One, they have to advise in our curriculum and making sure that we meet the current industry standards. They also, in many instances, have to provide clinical capacity so that our students have a work-based learning component. Just about all of our programs on some level requires, as a part of completing the program, that they have what we call clinical rotation or internship, so that we can validate that they're meeting the competencies required to be successful in the role. And then the other aspect of that is for the our workforce partners to advise us on future trends in terms of where things are going, so we can make sure that we ensure our curriculum's on the cutting edge of trends that are coming up in front of us, to make sure that our students aren't left behind. We are in a very competitive landscape. The medical district in Chicago itself is a very large source for healthcare providers, in which case we have to make sure that we're meeting the metric compared to our counterparts. We have competitors that are outside the district, as well as some internally as well. So for us to make sure we have that quality standard is absolutely essential.
Thanks, Roy. Liz, as part of the AIR, American Institute for Research, and the Promise Center, you've been working with city colleges for a little over a year. Can you tell me about the Promise Center and how the goals of the center connect to the centers of excellence at city colleges?
Sure. So after about 2 decades of work, actually connecting with Niggy Edgecombe and also many adult education research, I moved over to AIR to help lead our Promise Center, which stands for Promoting Resiliency, Opportunity, and Mobility in Service of Equity. Our goal is really, as I mentioned, to improve workforce training, workforce development for all individuals in multiple different settings. We really start with the premise that there are programs that have been studied rigorously that have actually affected earnings 5 to 9 years outside of participation. These programs range anywhere from 6 months to 2 years, and they have really kind of beat the barrier of what many workforce training programs have had over the decades, an inability to really affect earnings. Part of our premise is to learn from some of those programs. Many of them are more boutique programs in nonprofit settings, very different environment than a community college setting. We are working to, as one of our focus areas, really try to think about how to adapt those kinds of effective practices in post-secondary environments, and particularly in community colleges, which are already present and scaled in all of our communities throughout the country. And so our work with city colleges has really focused on helping them think about their centers of excellence model, which already incorporates many of these effective practices, but then also to really be able to think about and learn what are the kind of systematic lessons and approaches that we can think about in a community college setting that many of these other more boutique programs, such as a Year Up or a Perscolis or a Project Quest, how that can work in a post-secondary setting where there is very different policies, very different bureaucracies, and to really be able to think about how can you do things like a more systematic approach to work-based learning. How do we do that in a post-secondary environment where maybe that's not always funded? How do you think about how you connect with labor market outcomes, which is often very difficult because of the differing data systems between tracking employment and earnings from post-secondary achievement and graduation. And so we really have a pretty comprehensive approach to really thinking about this, about across 5 different focus areas of work with the city colleges, along with helping the colleges and the district grow ownership in the centers of excellence model around these particular industries.
Thank you. So David, you represent one of our strong work-based learning partners. Would you describe how you work with city colleges and why your organization has made the commitment that it has?
Yes, absolutely. And let me provide a little background on the Zurich apprenticeship program. So Zurich had this idea to bring apprenticeship, a concept that has often in the U.S. been associated with the trades for decades. This concept has often been associated in corporate settings as well with Zurich, Switzerland. Our original organization, it has very strong Swiss roots. And so we wanted to take that model and bring it to the U.S. So in 2016, we launched the Zurich apprenticeship program. And our goal was to hire 100 apprentices over the course of 5 years. Just at the end of last year, we achieved our goal, and we're now in our second iteration of that. Our North America headquarters is located in Schaumburg, so just about 40 minutes outside of Chicago, but we were really itching to get into Chicago. We really wanted to tap the very rich, diverse talent population that exists within the city, and to also complement our Zurich office that we also do have down here in downtown Chicago. And so we knew the time was right as we were looking at what the second iteration of our apprenticeship program was going to look like, was to now enter the Chicago market. And so in addition to our work with apprenticeship over the past 5 years, we have been a founding member of the Chicago Apprenticeship Network, along with Aon and Accenture, in addition to a number of organizations who have joined since. It's a very large organization that helps promote apprenticeship and offer a variety of opportunities. And we were able to leverage other industry leaders within this network and their relationship with city colleges. So it was pretty much a no-brainer for us that city colleges was going to be the first place that we came to try to enter into the Chicago market. And so we've reached out, it was probably like maybe early winter last year to have some initial conversations. Knowing that this program has existed for so long, we knew it would kind of be an easier lift, which we were very grateful for, because this past year, with our second iteration of our program, we were taking on cohorts of about 15 to 25, maybe 30, and we wanted to triple that. So this past year, our goal was to take on 75 apprentices. And so not only did we enter Chicago, but we entered about 11, 12, 13 different cities at the same time. And so that partnership with city colleges was going to be very important. So during our initial conversations, we were just really impressed at the very intentional curriculum design that would really complement our business needs and what we wanted to supplement this whole earn and learn model with. So that's pretty much why we've reached out to city colleges, and it's really been a tremendous benefit. Over this past year, our newest cohort in Chicago started in August and just completed their first semester at city colleges, all above 3.0 GPAs. So it was fantastic.
Wow, that's really great. So thank you for your commitment. Liz, can you tell us a little bit about what your team's working on with city colleges over the next year and the impact that you think the work will have on our students and our city?
Sure. In the community college space, there's been a lot of work and research in academic pathways and systematic change in academic pathways. Really, our approach is to think about this as a complementary side of community colleges and workforce training, many of which go into academic pathways as well, longer-term associate's degrees, transfer to four-year colleges. However, our commitment is really to try to understand how do you build a more systematic approach to workforce training in community colleges If anyone's attended any post-secondary events in the last few years, you know that many funders, many government organizations are really calling for a better understanding of how do we get students credentials in shorter term ways, how do we get them into the workforce, how do we get them into living wage jobs. And really our approach is to really think about that systematically, starting with the city colleges, but ideally expanding to cohorts of colleges throughout the country around the lessons we're learning with city colleges. So our approach is really, I think it's fivefold. Right now we're working with the city colleges to think about how to connect their higher education data with data on labor market data to be able to track the enrollments and performance of individuals who enter the city Centers of Excellence programs and how they do after they leave those programs. We're also working to help strengthen city colleges' ability to analyze labor market information and think about how to put that, use that information within the curriculum and content development process. We're also hoping to be able to vet that information and help strengthen and help city colleges develop a more systematic approach to employer engagement. And then we're also looking to further strengthen their systematic approach to work-based learning. In our view, these are the kind of key things that many of these effective sectoral programs that have really affected earnings, these are many of the components that they have all together in one system, and really thinking about how do we do this in a post-secondary setting where there's a very different environment. And City College is really the perfect place to begin this. They already have the Centers of Excellence model. They have a wonderful leader in Juan Zelgado who's very familiar with many of these sectoral programs that really work with the student where they are. And so that's really our approach, and we're super excited to be able to share lessons with the larger post-secondary field about this crossover between workforce training and academic pathways.
Well, we're so grateful to have your team working with us, or your teams. As you heard, that is quite a scope of work. And there are multiple teams that are working on the ground with people from all of our colleges on each one of those threads to try to deliver outcomes here in the next few months even. So we're going to talk a little bit more, dig a little deeper into this work-based learning conversation. David, you were an apprentice. I'm going to out you. Can you tell us a bit about your own experience and how it helped you in your career?
Yes, absolutely. So I actually joined Zurich through the apprenticeship route. There's typically about 4 populations or maybe demographics that we target for apprenticeship. One is recent high school graduates. Another is veterans. Our third is typically individuals maybe looking to re-enter into the workforce. Oftentimes that might involve stay-at-home parents who are looking to come back to the workforce or start for the very first time. And the fourth is career changers. And so I represent that fourth demographic, career changer. Prior to joining Zurich, I was actually working in higher education at a few different universities, and I loved what I did. But I was also thinking that the time was right to kind of make a shift in my career. And having worked in higher education, I was familiar with what an apprenticeship model was. And specifically, this was kind of in the early iterations of the Zurich apprenticeship program. We have a number of education partners. So at that time, I was working out of our Schaumburg office and was taking courses at Harper College. And it's interesting because with so many different populations coming to the Zurich apprenticeship program, you know, there's a lot of different career pathways and trajectories that can result based on your level of experience that you're coming into Zurich with. You know, maybe some of our newer high school graduates are learning those foundational skills. As a career changer, I was able to kind of leverage my past experience and work in a few different areas within Zurich. And so specifically, I was looking to enter into the apprenticeship program because at that time, I was currently working, right? And the whole concept of apprenticeship is to reduce those structured educational barriers that prevent people from entering into corporate positions. And so with our apprenticeship program, we pay all of our apprentices based on a 40-hour week, so it's a full-time salary. But in actuality, they're working for us 3 days a week, Monday, Tuesday, Wednesday, and then they're taking classes or some courses or certifications on Tuesdays and Thursdays. In addition to that, they are able to receive, 401k options, participate in all health insurance options. And so it's just like being an employee. And so what drew me to this was that you're guaranteed a job after the 2 years. So it's not like, oh, I have to go back to school and then hopefully I'm going to cross my fingers, I'll end up with something. This was guaranteed. So this was something that attracted me to it. So for me, it was kind of a no-brainer, an ability to earn and learn in a new industry and develop some new skill sets. And then as a result of my experience and my past experience, I was able to kind of grow and I would say accelerate my trajectory within the company. And so I've been with Zurich almost 5 years now. I started as an apprentice, I moved to an associate, then to an analyst, and now I'm a business consultant. And I'm currently working on the Office of Apprenticeship team. So I love the concept so much that I wanted to be involved on the team that makes these opportunities possible.
Thank you so much, and I really appreciate you talking about the different jobs that you had along the way, and also the fact that you were a career changer. You know, so many of us have had that experience of being a career changer, and what an awesome opportunity to connect with an apprenticeship so that you really could, take advantage of that new learning. Roy, in healthcare, work-based learning is essential. It's a required element in the training. And what are the challenges you experience? What are the benefits to the student and also to the employer?
So some of the challenges that we encounter with our students is honestly understanding the rigor it might take, especially if they are someone that has to work a part-time job or take care of loved ones. One of the things that we try to do early on, especially in our admissions process and our open houses and onboarding of students, is really to give them an understanding of what is required and to understand that we have support services to help with them along the way. And then also, there's also this situation in which the enculturation of the student while they're actually at the workplace. Sometimes understanding the culture of healthcare is a little bit different for students at first, but what we find is that through ongoing engagement with our partners and then great relationships that our faculty have with those workforce partners, our students are more often than not very successful. Majority of our faculty still in some way are still tied to their profession where they're either working weekends or part-time hours. So they're really adept and really present to what's required. And so they're actually able to embed some of that acculturation into the classroom so that students aren't so much surprised when they do start their clinical rotation. But then you also have the notion of some of our programs, the length of time. I failed to mention earlier that our programs, they range in time frame. Some last 1 semester, some are just 3 semesters, some are a full 2 years on top of what's required as far as a full semester or for your prerequisites. And so going through a program for a year and a half, 2 years, whether it be in our radiography program or nursing, can be extremely laborious and sometimes kind of wanes away at the spirit of the student. But City Colleges has been very fortunate where we provide the wraparound services, be it through our Access Center, so they can have additional time on exams or note takers and things such of that nature. We have a wellness center that can help with the students dealing with some of the stresses of everyday life, food insecurity, sometimes housing insecurity, and obviously, we all understand a lot of the issues that the pandemic has exacerbated with each of us all. And so sometimes our students need that extra touch of care to help them along their way. And fortunately for us, we've been a huge supporter of that, and our workforce partners have been very understanding as well. Beyond the challenges to get into the program, because it is very competitive. We have typically 2 to 3 times as many students applying for highly coveted slots. One of the challenges that we're finding for our students is that if we don't have a slot, what is that secondary or tertiary option for them? And sometimes our students aren't readily aware of the full offering that we have here at City Colleges. And so it's our job to make sure through our admissions process that not only are they having a selection of one career pathway, but we give them several others. And right now, we're investigating more with our workforce partners that are things that are not directly related to a clinical profession per se, but there's a huge amount of opportunities in research that we're finding that a lot of our students are actually able to meet some of those needs, provided that they have the opportunity and that they're made aware of it. And so that being said, some of our biggest challenges is trying to meet the demand. We have a lot of students that come to Malcolm X that are designed to go into nursing and or radiography, but the reality is that we do have limited seats. And so while it's a good problem to have, it's not good on behalf of the students, because we want to make sure that everyone does have a pathway and that they are able to be successful. And sometimes having to put delays in their time to be admitted is somewhat of a challenge. So we're trying to find ways that we can increase our capacity, increase our bandwidth, be it through sharing our programs at some of our sister colleges, or reigniting ways in which we can deliver them so they're delivered in a part-time capacity as opposed to full-time.
Thank you. I want to remind all of you to write down your questions as they come to mind, as we'll have time for Q&A here in a little bit. Liz, as you listen to these examples and think about the breadth in the centers of excellence, can you share your thoughts, experiences about the benefits of getting students connected to the workplace while they're learning?
Sure. I think that what Roy really points out is that I think in the healthcare fields, this is really a space that is a lot like some of these sectoral programs where there is ingrained work-based learning opportunities. And we think, at least kind of our hypothesis, is that is one of the key elements of why some of these programs have been able to affect earnings in the long term. As Roy mentioned, that's kind of ingrained in the healthcare fields. It's not necessarily ingrained in other fields, right? So understanding really and thinking about how do we systematically approach that to be able to build that in all sorts of fields, even where that's maybe not a part of the accreditation process or a part of the certificate process, but we're learning those kind of job readiness skills, actually being there in the work, is really where you begin to learn about that. And I think that's both what both of my panelists here have been talking about, really. And so, our hope is that that we can help colleges like the city colleges to think about, and leaders at the city colleges to think about that in a systematic way. I think some of the challenges, and I'm even learning since I've joined AIR, of the crossovers, or actually the isolation between workforce development training and academic kind of post-secondary education. What we really hoped is really think about the bridge across those. And I think work-based learning really represents one of those key areas. It's really, for those of you that are in post-secondary research, something that they're really calling for as well, whether it's 2-year or 4-year. And it's really a relatively new area. Having worked on a career readiness internships project a couple of years ago, trying to find research about how to do work-based learning in post-secondary settings, there wasn't a whole lot out there. There was some gold standards, but in terms of research, there wasn't as much of that there. And I hope we can really grow that, both in the actual innovation of the work, as well as the research on what are the successes and challenges of doing that systematically in a post-secondary setting.
Thanks, Liz. I'm going to ask you to continue on, because as we're talking about successes and challenges, from the workforce lens, how can we address equity in the workforce outcomes through the Center of Excellence model?
So I think part of what the Centers of Excellence model does is really helps individuals to be able to get quickly into careers if that is the pathway that they want. I think many researchers, policymakers are really trying to find ways to help individuals to get into that workforce quickly, to get living wage jobs. That sometimes it's hard to actually have, to be able to spend 2-4 years in a college. And I think the Centers of Excellence models allow individuals to be able to do this in shorter periods of time, and in many cases also be able to apply the credits that they're gaining within those programs to further education later on, if they want that. So I really think that the opportunity to build these kinds of pathways in post-secondary settings, particularly in community colleges like the city colleges, where you're already throughout the city, community colleges are throughout the country. How do we do an even better job of helping those individuals get into living wage jobs and really strengthen those practices?
Roy, you were talking about the fact that your programs are highly competitive, and you have more students, twice as many students as you have slots. So what are the challenges you face when you think about diversifying the healthcare provider field?
Well, I'm glad you asked me that question because I was on piggyback on what Liz just said a moment ago. So we approached equity with the admissions process of our programs about 3 years ago because what we found was that some of our processes, as it relates to how we vetted students, may not necessarily been the best practice to make sure we promoted equity and diversity in all of our programs. So we started looking back at resumes, recommendation letters, GPA, which is a really big one. And we started thinking about ways and means in which we can reevaluate the likelihood of a student being successful, because at the end of the day, it's not so much that you have the highest GPA coming into the program, but that you're likely going to be successful, that you're going to be complete, and that you're going to get pass the certification exam. We got still a little ways to go around that because when you're working with specialized accreditors, anytime you have any type of dip in threshold of those programmatic outcomes, be it retention, completion, pass rate, or employment, obviously we get very nervous, and we have to make sure we hold that standard. And so now what we've done is we've moved to what we call mixed mini interviews, where it's a panel of students kind of going through a lot of different phases so that it's not these stagnant questions that they're being asked, but there's situational scenarios just to know how they work within a team construct. We've taken away redacted names and age and identity for some of the applications so that it's almost like a blind look at it. And we've involved our partners in that process as well because they also seek to have a diverse workforce. And in healthcare, it's understood that when you have people from like communities providing patient care to those patients, the likelihood of that patient care being at the satisfaction of the patient is very, very high. And so we know that we work with them in tandem to strive for that. And so incorporating measures in which we can ensure that through our process, we can help maintain that diverse workforce is something that we're committed to.
Yeah, thanks. And I appreciate that you brought up the partners because if you can diversify the student population, you still need that help from the partners to make sure that those individuals get hired and also then that they feel a sense of belonging in that organization. So David, your organization has worked with city colleges and considers the apprenticeship model as part of your hiring and talent strategy. Moving forward, what are the challenges as you've talked about expanding the program, and what advice would you give to city colleges as we try to expand the pool of applicants who are ready for work-based learning?
Sure, absolutely. So, before moving forward, it's important that we first had to look back at, what it was that we were trying to do with apprenticeship. And it was to, address our retiring talent at Zurich. And we wanted to bring in the next generation of insurance professionals into the field with the goal of retaining them for a long period of time. It's not just a, hey, 2 years and good luck on your next venture, or thanks for being here. Our goal is to really retain our apprentices and keep them with the company. And we've done a fantastic job at doing that. And so looking at the challenges, what we've learned over the first, I would say, 4 or 5 years of our apprenticeship program is that apprenticeship is really a solution for all seasons. It can be modified, adjusted to meet the needs of your business, to accommodate the needs of individuals who are looking to return or enter into the workforce. And with that, we have to be very intentional as we are designing the program. So earlier, I listed, the number of reasons why I chose to participate in the program, right? We were very purposeful in designing it to attract the most amount of interest, to eliminate barriers so that individuals could enter into this apprenticeship concept, this apprenticeship method. And so, I think our first big test with expansion and considering, hey, is this going to work everywhere, was we started close to home in Zurich, North America at our Schaumburg headquarters. And during that time, earlier I mentioned we had a goal of hiring 100 apprentices in 5 years. After about 3 years, we said, hey, we need to enter another market. So we reached out to New York City, worked with the Borough of Manhattan Community College, and just about the next day pretty much was when the COVID pandemic hit, and we thought, how is this going to work? This has always been an in-person model, but we just adjusted like everyone else. And actually, just this past August, we successfully graduated our first cohort from New York City. And so we knew that this was a model that could last and work in all seasons, which led us to also working with city colleges of Chicago. So as we are expanding our program, looking to grow it, looking to attract more diverse populations, city colleges has really just been integral in helping us to meet those populations that we are most interested in. Whether it is attending a career fair, just doing one-on-one networking meetings, spreading the information and spreading the word. That's been really important to our relationship with city colleges, as well as being connected with other local community leaders or organizations. But the other takeaway is that, a lot of resources also already exist. So we don't want to create work and have to, create all these new partnerships. We just want to leverage the existing ones we have. So within Zurich, we have employee resource groups, and these are cultural groups that represent our different populations within Zurich. And so we work through them as well to have them help promote our apprenticeship program, reach the populations we're looking for, and to assist us with the expansion of our program.
I love that you brought up leveraging what we have. I don't know how many of you, I had the luxury at one point in my life to work with the insurance industry because they were having a bit of a recruiting problem. When most people thought about insurance, they thought about sales, and they didn't think about what this industry included. And I know when we started the conversation with David, he's like, well, our industry is IT. A lot of what we need is, in information technology. You talked about being an analyst. And so that kind of leads me to the kind of my final question for the panel before we go to audience questions. Please make sure you're writing down your questions. How can we use the centers of excellence and other channels to make more students aware of these opportunities that exist in the workforce? How can we use the centers of excellence and other channels to make more students aware of the opportunities that exist in the Chicago workforce?
Well, one thing is obviously to highlight our successes and pronounce them widely. One of the things that we do with each of our programs at the very end when they graduate, which is a celebratory occasion, I think we all would agree, anyone reaching their goal is something that we should promote and congratulate, celebrate, is we invite our workforce partners to participate in those. And interesting enough, because we have that work-based component to it as part of the curriculum, a lot of times our students are offered jobs before they even graduate, in which case we have to tell them, please don't hire them yet. No, we don't want them to work yet. They have to complete first. But that in and of itself is a way and means in which the word gets spread around. I think we all know that, our students learn about our programs through word of mouth much better than any type of advertisement we can put on social media or print to paper or even a commercial for that matter. And so using our homegrown students who have actually been the model to follow is the best ways and means for us to be able to support that. And so I know we're doing a really good job of doing that. It seems like all the time I'm hearing about some type of success story that we've had. Our chancellor makes it a requirement for all of our leadership meetings that we talk about the students. And I remember, Chancellor, when you first came here, you said it's everything about the student. So that's something that resonates throughout the entire district. And so as long as we kind of keep that most prominent for all of us, I think that we'll continue making success and strides that we need to make.
Thank you. Any thoughts, David?
Yes, absolutely. So kind of jumping off of what you said earlier is it can be difficult to attract individuals into the insurance industry because no one really quite understands insurance from the get-go and how it all works. And honestly, I don't think anybody from a child, thinks, I'm going to work in insurance. This is my dream. And so it's really important for us to demonstrate to potential candidates, to those who are interested in the apprenticeship program, what the insurance industry is all about. We are a global company. We have 40,000 employees all around the world, and we have customers in almost every country of the world. And so you can imagine being so large, it's not just insurance. Yes, insurance is, our bread and butter, and the insurance sector hosts the majority of our apprenticeships, but even within insurance, there's so many different classifications and categories, and it's not even close to people's perception thinking that this is a job of sales. It's really, that's just one component of what a career in insurance can look like. But also, working for a company that is so large, like you mentioned, there's a big need for IT, cybersecurity, finance, human resources. These are all departments that we host apprenticeship in. So I think specifically centers of excellence, city colleges of Chicago can help students make that connection that this can be a pathway towards their professional and career aspirations and ambitions by better understanding apprenticeship. And if you ever need any assistance, we now have plenty of alumni, and alumni are really like the key to gaining interest and commitments from candidates and individuals, because they're individuals who have lived the experience, they've walked a mile in their shoes, and typically I hate to say this word, but people will often say, that sounds too good to be true, it sounds like a scam. And then we could take 100 people, put them in front of them and say, hey, they all did this. And especially people that come from their communities, people that look like them, people who had similar upbringings and backgrounds. So I think that's really important and something I would strongly encourage Center of Excellence and city colleges to consider, and we would love your assistance in promoting the apprenticeship program or like opportunities.
Thanks so much. The question we have from the audience, many practical experience programs require background checks, an unsurmountable barrier for a large group of students. Justice involved, undocumented. How can we address this obstacle and provide greater access?
So I'll start. So that again goes back to working with the workforce partners. We have to make sure that our partners understand what our challenges are and what our students' challenges are, and making sure that they're amenable to making those changes where they can. As relates to background checks, because it's a healthcare field, it really depends on the partner and depends upon the degree of the situation surrounding that background. When it comes to undocumented students, we have several partners as well that are more than willing to work with us. But it is a very careful conversation that we have to approach, and it does come on a case-by-case basis. What's interesting, though, is that we actually just worked with some of our state legislatures to pass a bill to allow for undocumented workers to participate in some of our healthcare programs, notably LPN nursing. And so we've made strides there already alone, which allows them to be participatory in our programs. But needless to say, we still have to work with our partners to ensure that they're going to close the other end of the deal, which is going to lead themselves to employment. So we do work very closely on each of those situations, but I know that we're making strides and we're improving it because by virtue of the bill that was just passed last year, I think there's a really upside that we can look forward to in the future.
Thank you. Do either of the other two of you want to comment?
I think I would just say that this is a huge challenge. This is part of actually another focus area we have for as part of the Promise Center. And our fourth focus area is really looking at populations that aren't currently well served within institutions, within some of these career pathways, in part because of these specific kinds of challenges. And then trying to learn from new and promising programs out there about what can be done to support individuals to be able to help enter the workforce, to help build vitality. One of our focus areas is actually justice-involved people, and particularly justice-involved youth, and really trying to, in this kind of area, we have 4 populations like this. We're really doing a background scan, research to try to really understand, if we don't know already, what are the barriers and challenges, but then also trying to connect with innovative programs who may not actually have much research about them yet, to try to really understand what are they doing, what do they think will really promote the success of different individuals. So I'm hoping that we would be able to really have some of that work inform the work that we're doing, and that's really the goal in the work that we're doing with city colleges. We're also working with some of these sectoral programs that I've mentioned to really think about how do you build better on-ramps for these populations into these kinds of workforce training programs that maybe have not always been able to serve populations with these needs and these challenges.
Well, thank you. Our time has come to an end, and I just want to thank all of you for taking the time to be on this panel today. It's a rich conversation. It's exciting. It gives me a lot of hope for connecting more of our students to that working and learning opportunity. So thank you. And I'd like to turn the program back over to Vice Chair Beth Swanson.